goals and then continued transmission, because we did not diagnose early, the transmission continues, and then again increased healthcare costs, because managing advanced liver care is far more expensive than early treatment. Right. So the antibodies are detected on an average 6 to 12 weeks after infection. Okay. So while HCV and core antigen will appear much earlier, approximately 2 to 14 days after exposure to HCV. So detection of core antigen as a surrogate marker for HCV RNA is a means to shorten the diagnostic window period and then confirm active infection. So core antigen in serum and plasma is a marker of replication. Hence, its detection can be used to diagnose viremia in recently acquired HCV infection or even chronic infection. So a positive antigen result can be used for the confirmation of active current infection. About 30% of people can spontaneously clear the infection without treatment and will still be positive for antibodies, but no active virus. This is important to know. Right, so not all of them are having current active infection, those are having antibodies. So what is new in HCV testing? So there is a new test, Alexis HCV Duo from Roche. This is an immunoassay ECLIA for the qualitative detection of the core antigen and antibodies, both at the same time in human serum and plasma. So for anti-HCV, they use the following, these peptides and recombinant antigens representing the core NS3 and NS4 proteins are used. And for HCV, core antigen monoclonal antibodies are used. So simultaneous detection from a single specimen into separate but parallel reactions, and then you will get an individual readout for both the antibody and for the antigen. So yeah, this is the same thing, it will shorten the window period. So how do you interpret this assay? So those are the cutoffs here. So if both antigen test is negative and antibody test is negative, then you know there is no indication of HCV infection, no further action is required, except if there is a known exposure to a positive patient, then you test for RNA. If both are positive, then yes, the patient has current HCV infection. You follow up with the quantitative RNA and genotype, which is required for monitoring the treatment and starting the treatment as per the guidelines. And again, if you have a scenario where antigen test is positive and antibody test is negative, it is the same. There is active infection there. Then you have a scenario where antigen test is negative but antibody test is positive. So you cannot rule out the active infection now. As of now, HCV RNA is still recommended where the suspicion is high. Right. So basically, this test will shorten the diagnostic window period by up to 3 weeks, enabling early detection of HCV infection. Sensitivity is very high, 99.6%, and specificity is 99.92%. And also compared to the HCV, nucleic acid testing, this detects only 1.8 days later than the nucleic acid test. So this is quite good. The HCV duo immunoassay is unaffected by potentially, interacting or interfering antibodies to HIV, which was an issue with the previous generation of anti-HCV assays, and also in countries with a high prevalence of HIV and HCV co-infection. Right. So these tests are also available from other companies like Biorad and Diosorin, and HCV antigen only is available from Abbott. The antigen has a 100% detection, has 100% positive predictive value for the presence of HCV RNA. So an early diagnosis of HCV alongside a highly effective antiviral medication is very crucial in eliminating the virus by 2030 as outlined by WHO. Alright. So now coming to hepatitis B, what is the burden in India?